Welcome back to WBRZ News 2 at 4. Dr. Stevens is here, and you have some information for us about a number of possible procedures.
Well, to reduce fat. And
this
is the time everybody wants to have a little bit of fat reduction. And, they want to have it before spring break. Well, I don't think that's going to happen, but maybe later in the summer, depending upon the procedure that we choose. And there are several of these that we can choose from. We're seeing more and more marketing with CoolSculpting all the way to laser liposuction. And the question becomes, I see all the time, is which one works and which is the best one for me? Well, CoolSculpting basically is a way of freezing the fat. It's applied by a clamp, freezes the fat, takes several treatments over several months. And it has some science to it, and you see some results with it, but it's not a way of really reducing the fat. And so it depends on the patient if we're going to use it or not. Liposuction is a very popular method that we've used for years, and it all involves, a cannula of sorts. Whether it's laser liposuction or tumescent liposuction, we put fluid in, we take out small amounts of fat, and then we wear compression garments on top of that to help the skin contract back around it. So the whole point is not what procedure we use, but seeing the right physician to determine if you're a candidate, one, for this. Remember, weight reduction is the best way to reduce fat, period. Okay, so if we have a good bit of adipose or fatty tissue, then we need to know which one is the best method for us. We don't want to have a lot of loose skin after we've removed this, and so you need to ask your physician, preferably a plastic surgeon that's board certified by the American Board of Plastic Surgery, who knows about these procedures, that can tell you which one is best for that patient. So we don't want to have a lot of these small procedures that they see a lot of physicians that they have minimal results from when their expectations are, I'm going to be skinny, and that's just not so.
So what should people expect?
Well, I think they need to decide, do I have small areas like love handles, do I have saddlebags that can be reduced with minimal effort, and you can do that with tumescent liposuction. It's a big spectrum. We can do this under local anesthetic all the way to using a device that we have here, which may remove more fat up in the liters of fat, and that requires general anesthetic all the way from local anesthetic. So it's a big spectrum. So I think that you need to see a physician that has the ability to diagnose the problem and recommend the right procedure for that patient. There's a lot of marketing out there, and we really have to wade through that in order to get the truth on what procedure that works for us.
Okay, and then I think a couple of weeks ago you were here talking to us about people who had lost all the weight and then they still had all the excess skin.
Right, and so we see a lot of that. Now, liposuction will not help lose skin, which is a very good point, and I think that's what you were making. And so that needs to have skin reduction. Now, we may use liposuction encompassing with that, but it is a surgical procedure with skin reduction. So liposuction is a great tool when used in the right hands and on the right patient, but it's not a panacea and it's not a miracle.
Okay, so you're seeing patients now coming in?
Well, we're seeing patients coming in that have they've been marketed to, and they have a lot of loose skin, and they're using or seeing some of these procedures like CoolSculpting and other things that will not tighten the skin up. It's not a way of removing a lot of fat, and so we're seeing those kind of patients. And so it's important that you see the right physician in order to educate the patient. That's the number one thing, and tell them, hey, this will work for you, or it's not going to work. But we need to be honest with these people, and so we can meet their expectations.
All right, well, thanks so much, Dr. Stevens, for coming in today. We appreciate it. You're watching WBRZ News 2 at 4. We'll be right back.